Pharmacy. I am your host, Dr. Christopher Greider. For anybody that's tuning in for the show for the first time, this show is specifically focused on health-based information to try and make it so that you guys can make great decisions on your own or to give you some extra help or advice in case you're unsure about anything going on in the healthcare world. So starting things off today, we have a little segment for our fun facts. We figured at this particular point, if you had watched one of our prior episodes, it was focused on specifically COVID vaccines. So at this time of the recording, we are still in the midst of dealing with the pandemic, but it has gotten a lot better. So as of right now, we're looking at about 24% of the US population has actually been vaccinated with at least a first dose, which is really good. So it means we've made some headway since the last time that we did our recording. But at this particular time, I figured it was a good time to update you guys on a little bit more on what's going on with the vaccines. So one of the big things is Johnson & Johnson is available now. So there's 3 vaccines that are currently available between Pfizer, Moderna, and Johnson & Johnson. They are all pretty similar to each other in regards to preventing any serious health issues occurring from ventilation, hospitalization, and potential even passing away or death. So with that being the case, any of the vaccines are good. I have had some people specifically request for the Johnson & Johnson one because it is a one-shot dose, which makes life a little bit easier for some people since you only have to do it once. In regards to general mild symptoms, it's not as effective as the other 2, so I've had a lot of questions about that right now. But with that being the case, my best piece of advice for you is whatever vaccine is available, please try to get that vaccine taken care of. I know for some people they're very particular, so unless you have a specific type of allergy towards any of the vaccines, or if you have any questions about it, it's a good one to ask just to make sure which one you may or may not qualify for. The other thing that I wanted to mention to everybody is at this particular time and from here on, they have opened up in the state of Ohio at least for anybody to be vaccinated that's 16 and older. Now, the thing to kind of keep in mind is with 16 and older, the 16 and 17-year-olds, they would only qualify at this time for the Pfizer vaccine because the other 2 have not been approved for anybody under the age of 18. So if you do call and you start asking questions or if you want to get your teenage kids taken care of that fall into that age category, the big thing to keep in mind right now is that not all pharmacies would be able to take those 16 and 17-year-olds, but if it's anyone 18 and older, you could go to any pharmacy or vaccination clinic and essentially get the vaccine done for you at that particular time. So with that being the case, one of the things to keep in mind is the Ohio Department of Health does have a website to try and help people to get set up for a vaccine clinic or to look for what pharmacies or locations have it. It is Get the Shot, so it's a website actually, I'm sorry. It is gettheshot.coronavirus.ohio.gov. So if you go to that website, it will list all the potential pharmacies and some of the new vaccination centers like the Wolfstein Center, which is a mass vaccine center. They're doing about 6,000 vaccines per day right now. It's a way to try and get people in and out faster and to ensure more population gets it done, so that way we can kind of reach that herd immunity that if you ever listen to the news or if you hear Dr. Fauci talking about it, that's what we're trying to aim for right now, just so that things can kind of get back to a little bit more of normalcy right now. The other thing to kind of keep in mind too is if you don't have access to online, the other thing that a lot of people don't realize is that you can use either your local libraries, which have computers available, or if you're not computer literate at all and are unable to do anything with it, you can actually call 211. So it's United Way's phone number, and they can actually help to try and see if they can get you signed up for a vaccine as well. So if you have any problems with any of those things, those are some extra resources to kind of help guide you to figure out where you can potentially get it done. Now, for our main topic today, one of the things that's come up actually is in a recent survey and poll that they found, about 61% of the population has actually gained weight over the time of coronavirus. So with that being the case, a lot of people have become a little bit more overweight than they were before. And one of the big issues that we run into then is typically cholesterol. So to help me kind of talk about high cholesterol or hyperlipidemia as they call it, I actually have a student here with me from Neomed. Hey, Bhavika, how are you doing today?
I'm good, Chris. How are you?
Good. If you want to introduce yourself a little bit, tell the people who you are and where you're from and things like that, that would be great.
Sure. So my name is Bhavika. I am a 4th-year student at Neomed, so I'll be graduating here in May, and I'm currently on rotation with Chris.
Perfect. So kind of starting off with everything, just in case anybody is not familiar with it or has not come across it before, so what exactly is high cholesterol, hyperlipidemia exactly?
So high cholesterol really just means that or hyperlipidemia really just means that you have high levels of bad cholesterol. So with that being said, not all cholesterol is bad, so there is some good cholesterol. So the typical differentiator between those two, there is low density lipoprotein and high density lipoprotein. So low density lipoprotein, otherwise known as LDL, is technically the bad cholesterol. So we don't want too much of that LDL. But then there's high density lipoprotein, and that's HDL. So we actually do like HDL, and we want higher levels of that than LDL. With that being said, there's also other contributing factors to cholesterol levels. So another thing that people look at is triglycerides. So with triglycerides, we typically don't want that to be high as well. So that's a little bit about hyperlipidemia.
Perfect. So in general, typically, I mean, just like everything else, there's lab values, there's things that we always look at to try and see like where is somebody at, because you may not know that you have high cholesterol.
Right.
It's not something that you typically feel. So looking at that kind of, like, what kind of levels are we looking at? Like, what are we looking for? What are we measuring? And how do people typically get that checked out?
Right. So like as you mentioned, with hyperlipidemia, you don't really have any symptoms of it. So the only way you can really go about getting that checked out would be through lab draws. So your physician would order you to get blood drawn, and then they would perform a lipid panel. So a couple things that they would look for on the lipid panel, there's going to be a chart that's pictured here. So one of the things that they look at is total cholesterol. So for total cholesterol, your goal is to be less than 200 milligrams per deciliter. Another value that we would look at is that LDL that I mentioned before, that bad cholesterol. And typically we want that value to be less than 130 milligrams per deciliter.
Perfect.
Okay. And then also we look at triglycerides. So for triglyceride, it's typically your goal is less than 150 milligrams per deciliter. And HDL, that good cholesterol, we want that usually to be greater than 60 milligrams per deciliter. So those are a couple different values that your physician would be looking at when they look at your lipid panel.
Perfect. So kind of in general, I mean, we have those lab values, we have those things that we're looking at. So the one thing that we always like to stress to everybody, especially from the pharmacy standpoint, is some cholesterol is good. We don't want you to be at zero. So that's a lot of people naturally think with other lab values, like if you have a 0, you're doing a lot better. No, your body does need some form of cholesterol in its system right now. So kind of looking at it right now, what are some things that we should be worried about if somebody was, say, running with like a high cholesterol?
So with high cholesterol, that cholesterol can form plaques in your arteries. So basically that means it's going to start building up in your arteries and then prevent blood flow. Now when you have prevention of blood flow to, say, your heart, that could put you at risk of a heart attack. But if you have, if you have lack of blood flow to the brain, that could put you at risk of having a stroke. And then lack of blood flow in your legs could just make it very painful to walk, and that's also known as peripheral artery disease.
Perfect. So you kind of mentioned it. So is it more so the blockage that's occurring? Is it anything that could possibly like break off or cause any serious issues at that point?
Absolutely. So some of the things that those plaques can do is if it erupts, that could cause some issues as well, and it also can break off and go to other parts of the body and cause issues there as well.
Okay, so we just need to be very cautious of it from causing any serious issues from that standpoint there. The other thing too is that sometimes with cholesterol, one of the big things that we always run into is that it can account for other health conditions too. So we have to be careful about having high cholesterol along with, say, like high blood pressure, because those two things, if they kind of work together, they can essentially make your entire cardiovascular system not work as well. So you could have, like you said, some heart problems or strokes potentially with that type of stuff too. So with that being the case right now, I mean, we always hear about having like high cholesterol and like, you know, it's a serious issue. So in regards to things that we could potentially do to like help prevent that from getting worse, what are some things that you would recommend to somebody that like maybe, you know, aren't medicine based? Because we have a lot of people that like, they don't like medicine, they want to avoid taking medicines, and it's understandable because there's a lot of side effects that can come with them. So what are some things that you would recommend for them to do that could possibly help with that?
Sure. So one of the main things that we like to focus on just for overall health to prevent anything would be to stop smoking. So I know it's easier said than done. So if you reach out to your physician, pharmacist to get some guidance on stopping smoking, that could be one thing that can help decrease those levels of cholesterol, but also just improve your overall health. So always recommend that. Another thing that we could do is, I know that Corona has prevented us from being active and exercising, but we should always start exercising. Typically the recommended amount is about 30 minutes a day. Especially with the weather getting nice now, so it would be a great option for you guys to go out and enjoy this weather that we're having and just staying active. So that is proven to decrease your bad cholesterol while also increasing that good cholesterol, so good option for you to have. Another thing that we always recommend is having some kind of control with your diet. So there's going to be a picture shown of this plate. So on this picture, it's recommended that we always have lots of fresh frozen fruits or vegetables, trying to avoid those canned fruits and vegetables just because they can have extra salt or sugar in them. Also eating foods that are high in fiber and also whole grain is a good option for people, and cutting back on anything that's processed or has a lot of fat in it is also a good thing to do. And avoiding things that have trans fats. So if you look on the nutrition labels that are provided for you on your foods, trying to avoid things that have trans fat in them. Other things would be to increase healthy fats, so like things that are in like nuts, seeds, also like healthier oils, so like unsaturated vegetable oils like canola oil or olive oil. Using those over like a vegetable oil would be recommended. Other things that you can do is also try to decrease the amount of red meat you're eating and switch that out for like a leaner meat, so like chicken or turkey or some type of seafood, or also just switching those out for like non-meat options like those nuts and seeds and beans. So those would be a couple different things that you can do as far as like things that didn't include medicine.
Perfect. And like you had mentioned, so one of the big things that we always try to stress to people is a lot of the times for their health in general, most of the time, like diet and exercise are the two biggest things. Nobody wants to hear it because it takes the longest out of everything, but it's one of the best ways to kind of help reduce any risk with anything, and especially when we're talking with like fats and things like that, that's a big one right there. So kind of breaking it down, because I know this gets a little bit more larger than some of the other disease states that we've talked about before. So what medicine-wise, like what kind of medicines are there out there that could potentially help somebody if, say, like diet and exercise doesn't quite do the trick for them?
Yeah, absolutely. So one of our first line options that we go to is typically a statin medication. So there's a picture that has a list of the statin medications on there for you. So if you are taking one of these medications, just know that it is for cholesterol. So the way that this medication works is it stops cholesterol from being made. It stops one of those really important steps in that production of cholesterol. So by stopping that, it's just not making cholesterol in your body.
Perfect. And then, so what are some things, like when we're talking about statin medicines, what are some things that people should like kind of know about in general that might be on any of those medicines that you had listed there?
Yeah, so with any of those medications, there's a risk of muscle pain. So some people don't tolerate statins as well as others. So muscle pain could be one of the things that you could have with this medication. That doesn't necessarily mean that you should avoid all statins. It may just mean that you need to try another one. So obviously that's a great conversation to have with your physician if you do have that. Another thing that you want to look out for is going to be liver damage. So one of the things that your physician will monitor with you when you are first placed on a statin is going to be your liver enzymes, and that's going to require another blood draw. So just so you're aware, that's another thing that they will be monitoring for you.
Gotcha. And so one of the other things that we always try to stress to patients sometimes too is with certain statin medications, they typically are best taken at nighttime. So a lot of people don't realize most of your cholesterol production typically occurs at night. So that's another big thing that we always try to stress to everybody. So with that being the case, just be careful of it. You can always double check with your pharmacist or your doctor. Some of those statin ones are best taken at night specifically. Some can be taken any time of the day, so that might make it easier. The other thing too is that sometimes if you have what Bhavika was talking about, which was that muscle pain going on, you can sometimes use CoQ10. CoQ10 actually helps to reduce the amount of that muscle breakdown occurring, so it reduces the likelihood of dealing with a lot of those pain or aches that you might deal with that come up with it. So, perfect. So what other medicines are we looking at right now?
So another medication is ezetimibe, otherwise known as Zetia. So this medication works by preventing any cholesterol from getting absorbed into the body, so like from your diet. So that is one of the ways that Zetia works. It can also be added to statin. So say if you're not meeting those cholesterol goals that we talked about at the beginning of this segment, that's another medication that can be added on. But with this medication and like statins, you could also have a little bit of that liver damage. So that's another thing that your physician would monitor with this medication too.
Yeah. One of the things that we always try to stress to people too is that with these medicines, they focus more so on the HDL and LDL sections of your cholesterol. A few of the ones we'll talk about will kind of hit some of that triglyceride portion, but it's one of the things that they will help to boost your LDL and help reduce your LDL essentially. So, perfect. And then anything else that kind of focuses with this general group right now?
So another medication that we could talk about, so these are newer medications. They're called PCSK9 inhibitors. Now these are very different than the statins and Zetia just because instead of being an oral medication, this one's actually injectable. So with that being said, it's not a daily thing. So these medications are usually every 2 or 4 weeks. So an injection once a month or twice a month. Typically with these medications, you may have a little bit of that injection site reaction, so a little bit of redness, that kind of thing. But other than that, they're mostly well tolerated. The way these ones work is by preventing your LDL, so that bad cholesterol, from sticking around in your body, so that gets taken out of your body a little faster.
Perfect. Yeah, and with something like this especially, it is newer medication, so the one thing, especially from our a community standpoint that we're looking at, is that it doesn't always get covered under your insurance. You may have to try some of the other medications first, but it is a nice alternative, especially if you do have a hard time with oral medications or with some of the side effects that we've mentioned for the few of the other ones. It's a nice alternative to try and do something else to ultimately help with your cholesterol. So kind of taking a look at it now, in regards to more of like the triglycerides and things like that, what kind of medications could we use to help with that?
So one of the medications that helps lower triglycerides is going to be known as a class called fibrates. So the medications in this class would be like gemfibrozil or fenofibrate. And like you mentioned, they mostly decrease triglycerides. So these medications are typically well tolerated, but like the statins we mentioned before, they can have some muscle pain or liver damage associated with them as well.
Yeah, so with that being the case, once again, it's one of the big focuses is essentially on our liver, make sure that everything's going well with it. And then there's one other group that we typically talk about a bit more, and that's something that's actually available over the counter, but they do it as a prescription as well. So it's kind of like the omega-3s, so can you talk about that a little bit?
Yeah, so omega-3s are actually medications that are going to help decrease triglycerides. So they are preventing your liver from making the triglycerides and forming those LDL particles as well. So this medication, like you mentioned, is over the counter, but obviously always talk to your physician and pharmacist before you just start taking them.
Perfect. Yeah. So yeah, typically with those medications, the biggest complaint that anybody ever has is normally in regards to the fish smell, or sometimes as they term it, fish burps, because they do derive it from essentially fish in order to get the omega-3 acid out of there. So some people could complain about that. They do make some ones that are odorless, which is really nice, and then they do make some that are lemon scented just to help kind of mask it. So that typically helps out quite a bit. Yeah, anything else that you can think of for those right now?
Nope, those are most of the medications that cover that.
Perfect. So with that being the case, any kind of takeaway points for today just to stress to everybody?
Yeah, absolutely. So like we mentioned, medications are not the end-all be-all for this disease state of hyperlipidemia. So obviously trying to focus in on getting that diet control and also exercising and stopping smoking is going to be a huge part of this, even if you are on medications. And just remembering that maintaining good levels of cholesterol is used to like help prevent any of those heart disease, strokes, or any other health-related cardiovascular issues you could have in the future. And obviously, with all these medications, you could also have side effects and also just interactions with medications or foods. So always talk to your pharmacist and physicians about any of those if that's a concern to you.
Perfect. Yeah. Well, thank you so much for talking everything about cholesterol with us today. One of the things, like she had mentioned, we always stress to you guys, if you have questions, concerns, if you have any, we want to know more knowledge about anything that we've mentioned today. Like we said, we always say reference your healthcare provider. So your physician's your number one go-to. They know you typically the best because they have a lot of your information, but your pharmacist will typically know a lot more about your drug interactions or what might be causing any serious problems for you. And definitely nurses out there can sometimes be very helpful too. So never be afraid to ask questions. That's always one of the biggest things. With that, we actually ran out of time for today's episode. So as always, thank you so much for stopping in. We hope to see you guys next time here on Fun Facts at the Pharmacy.